Now, tell me about your symptoms before the surgery.
Well, before the surgery, it was, I couldn't walk very far at all. I had pain and pinching, and after, well, even sleeping, sitting, standing, for just short periods of time, all of that.
1 to 10, how bad was the pain?
It was like a 10.
10?
I mean, it was...
For how long was it 10? How long did you have that pain before the surgery?
Oh, yeah, it started years ago and just progressively got worse
Okay.
through the years.
Now, we did the surgery about a year ago.
Yep.
Tell me about how long were you in the hospital after the
I
surgery?
was in the hospital just overnight.
Just over the night, okay.
Yep. And I was up walking that day. I walked
Same day?
stairs, same day.
Wow,
I mean, I had the surgery in the morning, and I think I was walking by noon.
excellent. Well, so the next day you went home.
Yeah.
Now, you had leg pain, correct?
Yes, I did. My
When
left.
did the leg pain go away?
Well, and it really wasn't a pain per se, more of an irritation, more of a
No, but before the
But
surgery,
before-
you had leg pain, correct?
in the back.
In the back
the
of
back
the leg.
of the leg.
When did the pain in the back of the leg
Oh,
go
that
away?
was gone right away.
Right after you woke
Yes.
up? Okay.
Yes.
But you did have some nerve irritation because I
that
had to
wa-
push the
right.
nerve to the side.
Yes, that's what it was, the nerve
Yes.
irritation
And
here.
so the pain before the surgery, radiculopathy, was
Mm-hmm.
gone when you woke up, but then because I had to push the nerve to the
Yeah.
side, and it's interesting, I'm going to turn around here. Here is your pictures from today. First of all, everything is in the perfect position, and the bone is very much, look at that here, beautifully growing. And as well, the bone in the back of the here, the facets are as well beautifully growing. So you have what we call interbody and posterolateral fusion. What happens is the nerve that goes down to the back of the thigh passes here to come out here. That's the L5 nerve root. And that was what getting pushed in what we call lateral recess. But for me to get in, I have to push the L4 nerve root, the nerve that's here, to the side. So this is the one I irritated. This is the one that you had symptoms. So this pain was gone when you woke up. But I had to push this nerve to the side, so you had some irritation of that. So describe that to me. How was that?
The irritation on the front of the leg
Yeah.
was more of a, it wasn't a pain. It was more of a nagging nuisance.
Yeah, how
maybe
long
more.
did you have it? Before it went away or got better?
Oh, jeepers. At first it was very, very irritating for probably the first 3 weeks.
Yeah.
Maybe.
What did we, before the surgery, we talked about that's a possibility,
that was a
right?
possibility, yeah.
What do you remember what we talked about
Well, you said because that the nerves had to be moved, which you would do gently, but that there was like a 15% chance of me having a little irritation on the front of the leg from moving that nerve.
Yeah. And you exactly had that. And how is it now?
Good now.
Excellent.
Yeah, I
So-
mean, very, very rare.
Okay.
Sometimes walking real slow or something may, but it's very mild, not near.
Yeah. You're 1 year out. How do you feel?
Oh,
Compared to-
wonderful. I'd do this again in a heartbeat. Like I said, I love you, I love you, I love you.
Thank you so much. I appreciate that. Now,
Yes.
your daily activity, are you where you want to be or getting there?
Pretty much, yeah, except for, the limitations on
Yeah,
the
yeah.
bending and the twisting.
The limitation
which-
that we gave you.
That you gave me.
Exactly.
Yes, right, we better clarify that,
yeah.
but yes. Other than that, I mean, I've been walking,
Excellent.
walking.
Excellent. So that sharp pain, 10 of 10 before the surgery, that
None.
was nagging you,
No.
it's gone.
No pain.
Excellent. Well,
No.
thank you so much
You
for the
bet.
interview. Any other comment, anything else you want to add?
Just that I am so glad that my sister said that you were here. I didn't have to go and have I had a minimally invasive surgery.
Yeah.
And I mean, I was 60 when I had the surgery done. I'm 61 now. And anybody I know that's going to have back surgery, I tell them, please check into this because
The difference is huge. Your
Yes.
surgery was literally 41 minutes and our blood loss was less than 2 ounces. And you
So that's
literally, you went home within a day
Yep.
This is an old-fashioned surgery. Not only that, the surgery is 4 hours and blood loss is about half a liter to a liter, but the
Wow.
recovery is much longer. The risk of infection is much longer. Generally, people achieve after open surgery, it takes them 6 months to achieve where our patient achieved that same milestone and goals within weeks.
Yeah.
So it's a huge difference. So and you are an example of it.
I'm glad. Oh, I am
Well-
so thankful that I ended up here.
Thank you. I appreciate that.